Hi, I am Dr. Raghav Malik, Cataract, Refractive and Cornea Specialist at Center for Sight. Today's question is, can you get LASIK done if you have gotten TREC or TCAT done? So first let's understand what is TREC and what is TCAT. So it's a very complex term, TREC, TCAT, but let's demystify it further. So TREC and TCAT are kinds of refractive surgical procedures that we do for patients who have keratoconus. Keratoconus is a disease wherein the cornea or the outermost layer gets conical, which is normally spherical. जो normally थोड़ा गोल रहता है वो cornea थोड़ा सा spherical या फिर चौंचीला हो जाता है. उसकी वजह से patients have difficulty in reading, they have difficulty in focusing, the lights are more spread out, the patients have kind of a double vision. So there are many types of treatments for keratoconus. Of them, the most advanced is TREC and TCAT. So TREC stands for Topo-guided Regularization of epithelium in keratoconus, and TCAT stands for TCAT, that is Topo-guided Customized Ablation Treatment. So what we do in these surgeries, we are basically the cornea which has actually become very conical. What we do is we are trying to just regularize the cornea. So we are trying to kind of shave the cornea so that we can give it a more regular shape. So if normally the cornea is like this, in keratoconus it becomes something like this. So with the laser we are trying to actually just kind of regularize the cornea, and then we follow this with using a cross-linking. So in cross-linking, once the cornea has been stabilized, we do a cross-linking so that the cornea becomes more stable and the chance of keratoconus progressing decreases. So again, in a short summary, TREC and TCAT are laser procedures that we use to regularize the cornea first and then follow it up with cross-linking to decrease the chance of keratoconus progressing. So long story short, no, you cannot get a LASIK done once you have a TCAT or a TREC done. Why? Because a TCAT and TREC are already laser procedures that have been done on the cornea to regularize the cornea. So once a laser procedure has been done on a patient that has a keratoconus, doing one more laser procedure becomes dangerous. So no, we cannot do LASIK after TCAT or TREC. But yes, if you do have a residual power after TCAT or TREC, let's say after a TCAT or TREC you have a -5 or a -6 power left, you cannot do a laser procedure, you cannot do LASIK, you cannot do surface ablation, you cannot do smart surface, you cannot do silk or smile. The only option that we are left with is an ICL or a Phakic IOL, that is a contact lens which is placed inside the eye permanently that can take care of majority of your power. But yes, you might require a certain type of contact lens even after ICL to give you better quality.
Follow Planet LASIK and post your queries to get answers from the experts.